Okay, this is your video for canine spinal assessment. So this is how you would assess the spine. So first of all, you'd start with range of motion. So you can start with head extension. So asking the dog to flex, extend up towards the ceiling, and then flex down. So exactly the same hand positions as your wrong ones. And again, you can see the dog's restricted towards the right and then also towards the left. Then you're going to palpate from basically C1 all the way down the back, all the vertebrae. So you're palpating the dorsal spinous processes here. And what you're looking for is to see is as you apply any pressure on the dorsal spinous processes, if there's any fasciculations which the dog is doing here. And as you come back into the lumbar region, when you get to the lumbar-sacral junction, you just want to apply a little bit of extra pressure there just to check that the dog is not painful in that region and can withstand the pressure. While you're down this end, you do flexion and extension and then lateral movement of the tail. And then if this dog had a long tail, then what you would do is go down and assess the movement of each of the little tail vertebrae all the way down. So then what we're going to do then is palpate either side of the spine all the way down. So again, you're assessing for any muscle fasciculations. So it's very gentle, we're not applying a lot of pressure, and just seeing if we've got any fasciculations in the spine, which you can see there. The next one is we're going to check dorsal ventral movement. So Helen is just applying very, very gentle pressure here. As you can see, Bracken is springing nicely down through the thoracic region, but as you come into the lumbar region, she becomes quite fixed. So this bracing is normally when they're sort of guarding a region of the spine that might be slightly uncomfortable. The next test is cutaneous trunci. So you're going to go down and pinch a tiny, tiny amount of skin. As you can see, the dog here is fasciculating very nicely. Obviously, you assess both sides. And that's just to check that your nerve roots are working as they exit the spinal cord. So you're just checking that you haven't got any blocks or imbalances there. And that's your video for canine spinal assessment.